Wake TF up. Welcome to the Sovereign Signal, the channel of sovereign fire. Medicine, your grandparents were told to trust the doctor. The family physician was a figure of authority, dressed in white, carrying the aura of science. He knew their names, visited their homes, and prescribed remedies they believed were designed to heal. But behind him, the capture was already complete. In 1910, the Rockefeller Foundation funded the Flexner Report, which reshaped medical education in America and rippled worldwide. Natural remedies, herbal traditions, and community healers were branded quackery. Pharmaceutical science became the only legitimate path. Generations of healers were erased, replaced by laboratories, patents, and profit. Names matter. Abraham Flexner wrote the report, but it was Rockefeller money that dictated its conclusions. John D. Rockefeller, oil magnate turned philanthropist, saw medicine as the perfect domain to monopolize. By funding universities and hospitals, he controlled curricula, research, and practice. The American Medical Association enforced the new orthodoxy. Doctors who practiced outside the pharmaceutical model were discredited, prosecuted, or shut down. This was not progress. It was capture. Your grandparents believed in the family doctor because he seemed independent. In reality, he was trained in Rockefeller-approved schools, taught to prescribe patented drugs, and conditioned to dismiss natural remedies. The dignity of generational wisdom was erased. By the mid-20th century, the pharmaceutical giants had consolidated power. Names like Pfizer, Merck, and GlaxoSmithKline rose to dominance. They funded research, influenced regulators, and lobbied governments. The World Health Organization, founded in 1948, was presented as a global guardian of health. In reality, it became a funnel for pharmaceutical influence. Campaigns were dictated by corporate interests. Vaccines, pills, and treatments were promoted not as care, but as profit streams. Your parents were told to trust the NHS. Founded in 1948, it was presented as a beacon of free healthcare. Aneurin Bevan promised dignity, equality, and care for all. But by the 1980s, the siege had begun. Margaret Thatcher introduced privatization, outsourcing, and cuts. Hospitals merged, staff stretched, and patients waited. Pharmaceutical lobbying grew stronger. The NHS became a funnel, not a sanctuary. Names matter again. Thatcher's government opened the door to private contractors. Tony Blair's government expanded public-private partnerships. Each reform was sold as efficiency. In reality, it was erosion. Waiting lists grew, services shrank, and dependency deepened. The promise of free care was hollowed out. Your parents queued in NHS corridors, believing delays were unfortunate. But they were engineered. Austerity was dressed as necessity. Cuts were dressed as progress. The system was hollowed out deliberately to funnel populations into pharmaceutical dependency. You are told to trust health campaigns. You are bombarded with slogans, statistics, and fear. Get vaccinated. Take your pills. Trust the experts. Campaigns are theater. Fear is weaponized. Obedience is demanded. Corporations profit. Names matter here too. The WHO dictates campaigns. The Bill and Melinda Gates Foundation funds them. Pharmaceutical giants supply the products. Governments enforce compliance. Populations obey. This is not care. It is capture. Fear is the weapon. Fear of illness. Fear of death. Fear of being left behind. Pandemics, epidemics, crises, each one a ritual of obedience. Masks, lockdowns, vaccines, each one a lever of control. Hospitals are funnels, not sanctuaries. Staff numbers rise, but services shrink. Patients wait, suffer, and depend. Pharmaceutical monopolies dictate policy. Patents dictate price, and governments obey. Think of your grandmother trusting the doctor's word as gospel. She believed he was serving her health, but he was serving a system already captured. Think of your father waiting in NHS queues, believing the delays were unfortunate, but they were engineered. Think of yourself today, bombarded with health campaigns, told to obey, told to medicate, told to comply. You think you are being protected, but you are being conditioned. Medicine is not care. It is capture. Medicine, the theater of medicine in the 21st century, is not healing. It is obedience. The swine flu scare of 2009 was the rehearsal. Governments rushed to stockpile Tamiflu, produced by Roche, spending billions. Later, independent reviews revealed the drug had little effect. Populations were conditioned, corporations profited, and fear was normalized. That was the test run. Then came 2020. COVID-19 was the ritual perfected. Lockdowns froze economies, masks became symbols of compliance, and vaccines became the new sacrament. Pharmaceutical giants reaped record profits. Pfizer, Moderna, AstraZeneca, names that became household words, not because they healed, but because they dictated policy. Governments enforced, media amplified, populations obeyed. Albert Bourla of Pfizer stood as a global figure, dictating timelines and doses. Stefan Bancel of Moderna profited from billions in sales. Bill Gates appeared on television, shaping health policy despite not being a doctor. The WHO directives. Governments enforced them. Media amplified them. Fear was weaponized. Obedience demanded. Profit extracted. Hospitals became funnels, not sanctuaries. Staff were applauded on doorsteps, but inside wards, resources collapsed. Waiting lists exploded. Non-COVID care was delayed. Patients suffered, and dependency deepened. Pharmaceutical lobbying grew stronger. Vaccines were prioritized, treatments sidelined, natural remedies dismissed. The captured body was exposed. Your grandparents were baited with trust in the doctor. Your parents were trapped with trust in the NHS. You are shackled with trust in health campaigns. And your children will inherit chains heavier than yours unless you wake up. Campaigns are not care. They are conditioning. Stop smoking. Eat less sugar. Get vaccinated. Each slogan is presented as health. In reality, it is obedience training. Populations are taught to follow directives, not to think critically. Corporations profit. Governments enforce. Sovereignty is erased. Names matter. The CDC in America dictates campaigns. The WHO dictates globally. The Gates Foundation funds them. Pharmaceutical giants supply products. Governments enforce compliance. Media amplifies fear. Populations obey. This is not care. It is capture. The captured body is global. Africa is flooded with vaccine drives funded by Gates. Asia is bombarded with pharmaceutical advertising. Europe is trapped in austerity and privatization. America is drowned in insurance and debt. Everywhere, the same families profit. Everywhere, the same dynasties tighten their grip. Medicine feeds fear. Fear feeds obedience. Obedience feeds profit. Profit feeds capture. The cycle is complete. The pandemic theater revealed the mechanics. Lockdowns were not just public health measures. They were obedience rituals. Masks were not just protective. They were symbols of compliance. Vaccines were not just treatments. They were tickets to participation. Populations were conditioned to accept restrictions, mandates, and surveillance. The captured body was ritualized. Names again. Tedros Ghebreyesus, Director General of the WHO, issued directives. Governments obeyed. Media amplified. Populations complied. Pharmaceutical giants profited. This was not care. It was capture. Your grandparents trusted the doctor's word. Your parents trusted the NHS. You trust health campaigns. Your children will trust digital health passes. Each generation is baited with a new costume. The captured body never changes, only the disguise. Digital health is the next cage. Abstract vaccinations, test results, and compliance. QR codes decide access to travel, work, and public spaces. Algorithms enforce obedience. Your body is reduced to data. Your sovereignty is erased. Imagine your child trying to attend school. The app denies entry. Imagine your neighbor trying to travel. The QR code blocks them. Imagine yourself trying to resist. Your health pass is revoked. Your chains tighten. This is not speculation. It is already being built. Medicine is not progress. It is capture. It is the ritual of fear, the theater of obedience, the siphon of profit. Your grandparents were baited with trust in the doctor. Your parents were trapped with trust in the NHS. You are shackled with trust in health campaigns. Your children will inherit chains coded into algorithms, enforced by governments, dictated by corporations. Wake up. See the captured medicine. Because until you do, the system will keep feeding on you. Generation after generation, dressed as progress, delivered as dependency. This is the sovereign signal. Support the mission. Like, share, subscribe. Wake TF up.